Mr. Kennedy, I thank you very much for accepting the invitation for this interview. In 2015, I was deeply impressed when you presented at the NetCon conference in Orlando for 6,000 people your core message. It was shortly after your book was presented, in which you described your struggle with addiction, with bipolar problems, and how it affected the functioning in your life. And what impressed me so much it was the openness you showed, the vulnerability you showed, and your strengths, because in your vulnerability, I thought you were very powerful. And it is the message of people who know what you're talking about that really can make change. So I'm a big fan of you. I followed you during the years. I've heard you more often. I've presented the recording of your presentation in the Netherlands, and now I hear everybody is telling the same. Yes, this is a powerful and important message. What is really important is what you did. You not only present your story, but you implemented in laws, in change. It was in the time you were a congressman or representative, I don't know what the formal word for it is, in the Congress that you made, and that's going to cite, it is the Mental Health Parity and Addiction Equity Act in 2008. And I know you told about it, the struggle, and how you fought to get addiction in this, and how important it still is to get it realized. And I think, yes, this is the way, this is important that we see this message and that we don't see addiction as a weakness or a character flaw or whatever it is, but it is something that we can help. And it is a silent epidemic that you see that more and more people get all kinds of addictions, and it can be on drugs, on alcohol, but it can too on gambling, it can be on social media, etc. And then we see it as a deep influence of society, and you bring in change there. So I'm happy that we have this connection, and we'll do that. Well, I told you a bit in the intro that Curacao is a small island. It is part of a very rich country, but the economy is here not too good. If I see the way I worked in the Netherlands and the way I work now here, there are a lot of less resources here. We really have to be careful in what makes sense. So this conference, where you're the first speaker in this conference, will focus on what can we do, what makes sense, what is a good policy to treat people fighting addiction and to help people with mental illness, because the combination is very common. I prepared some questions for this interview. And the first question is, what is, in your opinion, the most important factor in overcoming addiction? What helps you most to find your way out, and what is most helpful?
Well, thank you. I am a person who is in long-term recovery. For me, that means that I have not had to use drugs or alcohol since February 22nd, 2011. In order for me to get sobriety, I had to change everything in my life. I changed my job. I left the United States Congress. I changed where I lived, the people that I related to. I spent all of my basically first year in sobriety going to 12-step recovery meetings. I needed to build a community of support amongst my fellows
Mm-hmm.
who also were struggling with addiction, who many of whom had achieved real lengths of sobriety. And I was really anxious to get what they had. In other words, to learn from them how they um, achieved sobriety and how they maintained their sobriety. Now, the big challenge is we can always stop using drugs and alcohol, but as we say in recovery, how do we stay stopped?
Mm-hmm.
That's the problem. And as we know with addiction, it's a mental obsession. it's a physical allergy, and it's a spiritual malady. So, in order to tackle it, I had to first not use. That's the number one first step, is to not use. Two, I had to cope with the obsessions and compulsions to use. And in order to do that, I had to understand what triggered those compulsions. And I had to come up with solutions to deal with the anxiety and the compulsions in a way that was more constructive. And this requires something called cognitive behavioral therapy, in
Yeah.
essence, because
Hmm.
12-step recovery is really the evidence form of treatment for addiction and mental illness, for that matter. Cognitive behavioral therapy comes in many forms. There's cognitive behavioral therapy for anxiety, for post traumatic stress, for different types of addiction, for gambling addiction, for eating disorders, for any number of things. And what it means is that you act your way to different thinking. So if I want to change my behavior, I can't change my thinking with thinking, because my problem is a
Hmm.
thinking
Yeah.
problem.
Mm.
I have to change my thinking by the way I act. In other words, if I act in ways that are contrary to the way I want to act, what I end up doing is creating new neural pathways, new patterns in my brain, which will now fortify me with the experience of not using drugs and alcohol when everything in my body says use drugs and alcohol. So that next time I'm faced with the desire to use, I have other frames of reference to call upon for me to reinforce the fact that I do not have to act out. In other words, I do not have to drink and drug in order to get relief, that I will
Yeah.
survive this painful moment if I just wait and pause and ideally call on help from someone who also is in recovery, who will know exactly what I'm going through and who can remind me that, as we say in
Mm.
recovery, this too shall pass, meaning the feeling will pass. I have to wait, I have to pause, and then the feeling will pass, and then I will build up an understanding that if I just wait, eventually the feeling will pass. I will not
Yeah.
have had to use. And then
Yeah.
tomorrow is a new day, and I build a foundation of sobriety, which makes it easier for me to stay sober if I have more experience in
Yeah.
how do I turn away from drugs and alcohol.
Yeah, it's a great story how multifactorial it is. It's really a part of life that you had to completely turn over your life to get out of it where you're stuck in. And then you say, I got help from cognitive therapy, I got help of my community, perhaps I got help of my spirituality to find a way out and build a new life. And since then, you are recovered. And that means
And
that
I
you still,
might add, I
yeah,
have a psychiatrist who
yeah,
is trained in addiction psychiatry, because not
good,
all psychiatrists have that appreciation.
yeah,
And what I need is I need medication management, because
yeah,
in addition to my addiction, I have a mood disorder. I have depression and anxiety.
yeah,
It's formerly known as manic depression. It's kind of also known as bipolar spectrum. But the
yeah,
bottom line is, I can take medication for that and my depression. I just have to
yeah,
be careful what medication it is. So
yeah.
if I have an addiction psychiatrist who knows, don't prescribe Patrick benzodiazepines,
Yeah,
because if you prescribe him Xanax, he'll
yeah,
get addicted to Xanax.
yeah,
If you prescribe him Librium, he'll get
yeah,
addicted to Librium. Um, Even if you just prescribe him Neurontin, which is very helpful to me,
yeah,
it also has addictive aspects. And if my doctor
yeah,
doesn't know that, he could unwittingly, or she could unwittingly,
yeah,
get me back on the road of addiction. So it's
yeah,
a combination. Now, for a period of time, I was on medication assisted treatment. When I first was trying to deal with my opioid addiction because I was addicted to Oxycontin,
Yeah.
um, I was prescribed Suboxone. Suboxone was very helpful for me not to feel like I had to take Oxycontin all day
Yeah.
long.
Yeah.
And for those who could not get a doctor to prescribe Oxycontin, they would go to the street for heroin. And as
Exactly.
of course
Yeah.
we know today, it's not heroin on the street, it's fentanyl. And fentanyl is much more
Yeah.
deadly and lethal than heroin. And that is why this is a crisis moment, because when people relapse, they die. It
Yeah.
used to be if you had addiction, you had 9 lives. Many people didn't survive, but many people were able to struggle
Yeah.
for a long period of time. Those days are over because of the potency of fentanyl. People who might have been able to survive for years living on the street are dying at record numbers. And by the way, even young people who are just experimenting with drugs are dying because the potency of the drugs are
Yeah.
so powerful. Even if they think they're taking cocaine, there's fentanyl mixed in. Even if they think they're only smoking marijuana, fentanyl is mixed in.
Mm.
And
Mm.
so it's so important also with the spices and also with the methamphetamines. There is very powerful drugs that were not available to people who were addicted 20, even 10, 20 years ago. So for
Yeah.
your audience, I want them to know we're not dealing with the same drug problem we were dealing with 20 years ago. We're dealing with a really powerful, deadly illness. So if you
Mm.
combine the illness of addiction with the potency of these new drugs, you've got a
Mm.
prescription for death, which is why in the United States and frankly around the world, we're seeing
Exactly.
escalating rates of overdose.
Yeah.
And which is why I'm so grateful that you all are hosting this
Mm.
conference to talk
Mm.
about how you are going to help deal with
Yeah.
this challenge by helping
Yeah.
those who may, even if they're not as fully addicted
Mm.
yet. The real solution is early intervention.
Yeah.
So when I go to my
Yeah.
doctor asks me, is there a history of cancer in your family? And I nod my head.
Mm-hmm.
Yes, my
Yeah.
dad had cancer. My mother had cancer. My brother and sister. And
Yeah.
they ask me, is there a history of heart disease? Is there a history? And I say, yes, my grandfather died of a stroke. Now, the medical system knows to now screen me for cancer because there's a history of cancer. They also know to put me on an antistatin to keep me from having a stroke and to reduce my cholesterol. But the medical system does not know how to ask whether my father or mother or grandparents or uncles or aunts were alcoholic or also had addiction, other forms of addiction, in order to determine whether I am at high risk for addiction or mental illness for that matter,
Yeah.
because depression runs in my family. And then if you have depression runs in your family and you've experienced a trauma, we now know in the worlds of psychiatry and addiction that trauma is like a very toxic environmental factor in provoking, in many respects, someone who might be predisposed to addiction. So just like I would
Yeah.
have cancer and I would be around asbestos, I would be a higher chance of getting cancer. If
Yeah.
I have a predisposition for depression, anxiety, or addiction, and I'm exposed to trauma, then I am much higher chance to
Yeah.
succumb to
Our
these illnesses.
our last congress was on trauma, and one of the speakers going to talk more about the connection between trauma and addiction. So it's very relevant what you tell. And I want to stress the fact that you mentioned that it's important that the doctor has an integrated, broad view on personality, on what is your somatic history, what is your mental state, what is your addiction history, and not in different silos of care, but bring it integrated. Thank you very much for this first question, because I see you're hitting all the points I
Well,
had in my interview.
doctor, if you're an oncologist, you need to care about mental
Yeah,
health and addiction
yeah,
because my sister died of anxiety and depression because she had cancer.
yeah,
Now, her
exactly.
oncologist basically gave her a diagnosis of that she had a year to live from lung
Yeah,
cancer. She survived lung cancer, but she never survived the trauma because she was a mother
yeah,
of two teenage
yeah,
children, and that was so traumatic for her. So, if you're an oncologist, you had better understand
yeah.
something about psychiatry.
No,
If you're a cardiologist and you have a patient that has depression, you're 4 times more likely to lose that patient from a heart attack than if that patient did not have depression. And
yeah,
and of course, if you have diabetes and you do not have your alcoholism or you drink too much alcohol, you are putting your life in jeopardy for other illnesses like diabetes. So my point is mental health and addiction is not simply about treating the primary
yeah,
diagnosis of mental health and addiction. It's also about effectively treating all
yeah,
the other physical illnesses. Finally, let
yeah,
me say, doctor, I have visited the
yeah,
emergency room throughout my
yeah,
life so many times because I was not getting treated for my addiction. I had
mhm,
broken bones. I had irritable bowel syndrome. I had concussions. I
yeah,
had lacerations. All of these were symptoms of my untreated alcoholism and addiction. So
yeah,
if the medical system was only treating the cuts and the broken bones and the pain, they were spending a lot of money paying for the treatment of the symptoms of my addiction rather than treating the actual root of my problems, which was my addiction itself.
Thank you very much. I will use this part when I'm going back to the hospital. We have a general hospital here, and this is exactly the mission why I came here. Look further than the superficial side of the symptoms. No, it's a whole person way of treating and see what is the most essential problem to be treated. Thank you. Question two. That's another one. It has to do with shame. But there is a, in the law, addiction is seen on this island as a weakness. It's your own fault. It's your own guilt that you get addicted, and we're not going to pay for the treatment. And I know there are many countries in the world with this same vision on addiction. What is your view on this opinion, or what's your opinion on this view?
Yes, so no one wakes up in the morning and tries to make their family members angry at them. No
Hmm.
one gets up every morning and says, how am I going to lose my job? Or how am I going to get arrested? Or how am I going to end up killing myself? That is not the human response. The human response is, how do I want to get loved by my family? How do I want to win the affection and respect of my peers? How do I want to be a success in society? So no one should think that anyone chooses to live on the street begging for money, ending up being ostracized by their community. That's not what a normal human being does, which means that those people who are active in their addiction, they're really hostage. They're prisoners of their brain illness. And What we need to do is set them free from being hostage to their brain illness, because the people I am in recovery with are contributing members of society who not only are not just using drugs and alcohol, but who found a spiritual way of living that is
Mm,
making a difference in our country and our community. They are even more powerful as people, having been through addiction, and now
yeah.
they have something to offer this world, which, as we know,
Mm,
is suffering generally from a very toxic world of disagreement and discord and pandemic and
mm,
anxiety and uncertainty. In other words, we as the world community needs to understand that mental health has been something
mm,
that we have relegated to the margins of the society when we relegate and marginalize people who have these illnesses. President Kennedy, my uncle, was the first president of the United States to talk about civil rights. And he believed that depending on the color of your skin, that should not determine your opportunities in life. Now, no one chooses their skin color, no one chooses their background. And yet, as a society, we discriminate against people based upon the way they look, what their sexual orientation is, what their gender is, what their
mm,
religion is. And these are artificial um, barriers to people, because we're all human beings and we all want the same things in life. And people with addiction just suffer from an illness of the brain. We have not been able to understand the way human behavior is really a function of brain activity. And so that's what's led to stigma. Stigma is really nothing more than ignorance. It's really a lack of understanding. And what generates fear of people with addiction is really a lack of understanding. And what we need to bring, which is what you are doing through this conference, is to bring understanding that no one chooses to live a life where they put their lives in jeopardy by getting arrested and locked in jail, or whether they put their lives in jeopardy to die and to live with no meaningful life and existence. That's not the way people choose to live. Now, mental illness and addiction is treatable. But like with cancer, you cannot wait till it becomes a stage 4 cancer before you decide to treat it. We need to do like we've done with cancer or with diabetes or with heart disease. And that means we need to treat it early, meaning we have to understand, are people
mm, yeah.
vulnerable to addiction? Do they have trauma? Are they living in extreme poverty? What are their life circumstances? And by the way, do they have a family history? So just like we have a better understanding of whether you're at risk for these other illnesses because of your family's history, we need to take the same approach for mental illness and addiction. And if so, my medical system would have never prescribed me Oxycontin, Xanax, Librium, Adderall. Okay, I got addicted to
Yeah.
Adderall, Xanax, Oxycontin, Percocet. In other words, we need to have the medical system understand these illnesses. By the way, as a person in recovery, if I injure myself and I go to the emergency room, they ask me, "What are you allergic to?" And I tell them, "I'm allergic to penicillin because I get a rash." And I say, "I'm allergic to opioids
Yes.
because if I use opioids, I'm at
Yeah.
risk for addiction.
Yeah.
And that is deadly for me." So if our medical system wants to save lives, which is the Hippocratic Oath, to help people do no harm, we cannot allow the medical system to ignore the most important organ of the body, which is our brain. Our brain is the most important. Now, people may not always like people with mental illness or addiction. I can tell you,
Mm-hmm.
I was
Mm-hmm.
not a very nice person to treat when I was active in my addiction. So my
Yeah.
thanks go out to all of the psychiatrists, all
Yeah.
the therapists in the audience, because you not only are practicing medicine, but you're practicing a level of compassion that we desperately need in the world, because you are taking care of people in spite of the fact that they're often not easy to take care of. And that
Mm-hmm.
means that you are even more special as clinicians and providers. You have an even more difficult job than maybe some other doctor of medicine in some other disease category for whom it's easy to treat that illness. This is not an easy illness to treat, but it doesn't mean that we should ignore this illness and turn away from those who are suffering from it.
Well, thank you for your crystal clear message, and it is very helpful. And I think it is useful to have it presented in a way you do with the compassion. And for me, it's nothing more than logical to see it the way you present it. It's all part of a person and health. No health without mental health. So we have to all realize that it is important to have an integrated vision on what's needed for this person. Yeah.
Let me
Uh,
just add one more thing
Yeah.
about that. So, what I'm working on in the United States to show that it's not only the humane thing to treat these illnesses, but it's financially responsible. So, companies around the United States now, in the wake of the COVID pandemic, are seeing high turnover in their employment. People are
Yeah.
coming and going, and also they see employees who do not have good productivity because they're distracted.
Yeah.
They are suffering from depression, anxiety, maybe even a form of addiction. And so they know that addiction is not just the purview of the medical system,
Mm,
but the consequences of untreated addiction means that you, the taxpayer,
yeah.
spends more money
Mm,
on the criminal justice system. In
yeah.
our country, we have nearly from a third to half of our population in our jails and prisons are in jail and in prison because of their untreated mental illness and addiction. So, as a society, as you're tackling this in Curacao, you should know that if you look at the bottom line, how to save money for businesses, for the cost of our justice
Mm-hmm.
system, for all the other costs to the medical system, mental health and addiction treatment, early on in prevention especially, saves not only lives, it saves money.
Yeah.
But you need to
Exactly. Yeah.
organize the economic
Mm,
incentives,
yeah.
because in our country, as I know in yours, we don't have the financial reimbursements to pay for treatment and prevention, and it doesn't make any financial sense.
Yeah.
What we need to do is look at the true costs. What's driving the cost to the government, to the healthcare system? And if you want to save dollars on chronic disease management, treat mental health and addiction. If you want to save dollars on your criminal justice system, treat addiction and mental illness. If you
Yeah.
want to make for a
Yeah.
happier community with less
Yeah.
suicides, less overdoses, make sure you treat mental illness and addiction, and treat it early, just like we do with cancer and cardiovascular disease.
That was my third question. What would be your advice to the government representatives and the insurance? But indeed, it is this: the 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 costs are hidden and they are huge. You see it in road traffic accidents. You see it in violence in families. You see it in people having to be burglar or to rob people because they need the money to pay for their addiction. There are a lot of hidden costs, And it helps society if they open it up and see, well, perhaps we should treat this cause, this evil cause that is giving so much pain and so much damage to and economy is just a way to make it that we can see it, but
But the real cost
are
is
enormous.
for our children and
Yeah,
our brothers and sisters
yeah,
and our mothers and fathers. So none of us should want the current system because all of us will have a family
yeah,
member or we ourselves
yeah,
will need mental health care at some point. And if you are not satisfied with the anemic, fractured, fragmented
mm,
system because it's not affording your family member
yeah,
the optimal chance at living a full and productive life, you're basically saying the people that are most important to
mm,
you do not deserve the best opportunities at recovery as they would if they were suffering from some other illness. And I, for one, have 5 children, and I do not want my 5 children to not be able to get help if they ever need help. And I know that they're going to be at high risk because all kids these days are at high risk, some more than others. But if they need help, I want to make sure that help is there. And I guarantee
yeah,
everyone in your country, like everyone in the world, wants the best for their family.
yeah,
And we cannot tolerate that the only response to a mental health and addiction crisis is the criminal justice system
exactly.
or
Yeah,
the coroner,
yeah,
and we have to change that. And so it's a moral imperative for everyone to work to change the current system. And I thank everybody for dedicating their lives to helping solve for this challenge.
I think this is a very strong last lines of this interview, and your message is crystal clear. And we're going to discuss it. We got the 2 days following to see what it means, and I'm really very grateful that you took the time for just a tiny, tiny country in the world compared to the States, but that we see that the lessons learned in the States, and I think they're really I love the way that you work on the problems and make them that we can see them and you can work on it. And the open culture in finding new ways. It's not easy. I think the implementing of the parity is still a hard fight to get it done, but it is the right way. And I'm very curious what the results be of this. And it helps us some steps in the right direction.
So, people may not like people who suffer from mental illness and addiction, but they understand discrimination. And essentially, what we're fighting is discrimination. So, we have civil rights laws in our country, and I see the Mental Health Parity and Addiction Equity Act in the United States as a modern medical version of civil rights because it says you cannot silo and segregate mental health over here from the rest of medicine. So that's the way I would encourage you to approach it. If you put the right policies in place, you're going to get better outcomes for society, for your commercial sector, for employment, for a reduction in violence, for a reduction in criminal justice costs, for frankly, a reduction in healthcare costs. And most importantly, you're going to get a more humane healthcare system that will treat people, and that's the dignity we want for all human beings because we're all children of God. And we have to respect the spark of divinity that is in within each and every one of us. And that's why what you do to treat people with these illnesses is you're seeing the divinity in every human being. In I'm a very devout person, and I believe that we find our salvation in helping those that are least amongst us. And that is the only place in my studies of religion where you find salvation is to be there for the least one of these my brothers and sisters, you are there for me. And that is what I believe is the spiritual essence of helping people gain recovery, is to believe in them. And you find relief in your own life by helping others. And so the real solution is to get outside of, we all have problems, but to help others with their challenges is really the salvation for all of us.